I see leadership in you for the future. And he's like, this might be something you want to explore. So when I was looking at all these DrPH programs, they all wanted years of experience. And so I had made it a concerted effort right after I had graduated to literally build myself to being the best applicant when the time came. And so I had a really great mentor that would tell me every month or every other month, you should be adding something new to your resume, your master resume, whether it's a conference, a talk you do, a paper that you submit, a bullet point on your job duties, a training, whatever it might be. You should be actively, literally building yourself up for success. And he would say, Bryan, if you're trying to do it for your DrPH, it's a win-win situation, because if you do it really well, you make yourself the best possible applicant. But if you don't really decide to do that, you become the best public health practitioner out there anyway. And so he's like, you win either way. And so
This is the Public Health Millennial Career Stories podcast, where you'll hear about diverse career stories, career strategies, get tips, and learn from others to help you in your public health career journey. If you want to learn about public health careers, or just hear public health stories, stay tuned because you won't want to miss this. Welcome to the Public Health Millennial Career Stories podcast, episode number 48. Hi everyone, Omari Richards here. Before anything, be sure you hit the like button, hit the subscribe button, hit the review button, leave a review, and share it with a friend. Appreciate you all. Today's episode, a lot of great insights on this gentleman's journey in public health, and I think that you all are going to find a lot of great information and ways for you to just navigate your public health career from this episode. So without further ado, here's today's episode. Enjoy. Today, we have a multi-dimensional healthcare professional, educator, and researcher in healthcare delivery system redesign, performance improvement, and change management. He got his Bachelors of Science in Microbiology at Michigan State University, then got his Masters of Public Health at Michigan State University College of Human Medicine. He then went on to get his Doctors of Public Health at Harvard T.H. Chan School of Public Health. He currently works as a research fellow at the MedStar Institute for Quality and Safety, and as an assistant professor in medicine at Georgetown University School of Medicine. We have Dr. Bryan O. Buckley, DrPH, MPH. How are you doing?
Not too bad. How are you?
I'm doing well. It's always a good time to have conversations with Black men in public health. So it's a pleasure.
I know, it's Black excellence all day right here.
Every day. Absolutely. So how have you been doing and just been coping during like the pandemic?
I mean, not too bad. I mean, at first it was a little rough, I'm definitely more of an extroverted personality and definitely out and about. So it was a little bit of an adjustment. I did get the excuse that I had to move during a pandemic. So after graduating, moving back here to Maryland, it made it a little bit easier just because everything is new. So it was kind of a rediscovering, but I think I got my bearings now during this pandemic. Where it's been pretty good, and I'm really enjoying working from home.
Yeah, I could imagine. I'm glad that you got your bearings and you got settled, and hopefully we can find some sort of hybrid for working from home going forward, right?
Oh yeah.
Yeah. So how do you identify, and then tell us a little bit about your personal background?
How do I identify? So I guess one, I always identify as being Black. And I think that just in its own essence and all encompassing, no matter what type of Black, just Black excellence all day. But definitely culturally, my family is from the Caribbean. So I'm a first generation, so very much Caribbean American, to be even more specific. Antiguan American and St. Kitts and Nevis American. So my mother is from the country of Antigua. My dad is from St. Kitts Nevis. But really, when you think of his parents, they're from Antigua. So I just usually claim Antigua as like, that cultural upbringing root. So, and that means quite a lot to me as a whole. It's just everything I think I've done so far in my life. I've always kind of linked it back to my roots and the life lessons that I was very fortunate to get to know both sets of my grandparents growing up and spent a ton of time in the Caribbean. Often my mom, when I was I guess when my mom and dad got married, one of the requirements that she had when they decided to have kids was that, she and the kids need to make sure that they have money enough to go to Antigua every single year. And so all the way from birth to 18, most, parents sent their kids to like summer camp. I got like sent to Antigua. And so when I think of how I identify, definitely very much, first generation American citizen, but definitely those cultural Caribbean roots.
Okay, awesome, and that's dope. That's dope. And I'm glad that I feel like just in traveling in itself, just being from a different country, having that first generation experience, growing up in America, knowing what Blackness is in the Afro-Caribbean sense of the word, and then coming to America, it's a whole different perspective, and you get to learn so much. And I feel like I was talking to someone recently, and I was telling them about my life story and how I've been to all these different places and things, and they were like, I was like, yeah, that's kind of like one of my superpowers, that I've been able to go to these different cultures and really just appreciate it. And I think that's one thing that I bring to public health that I don't think too many people bring it. So yeah, it's awesome.
It is actually really interesting you even mentioned that because one of the things my mom always like made sure we did. I don't know, maybe this is a Caribbean thing itself, but every time we would go to Antigua, she would always have us go to one or a couple more islands because she thought it was really important, one, to know our own Antiguan heritage, but then also appreciate the uniqueness and diversity of the Caribbean by going to other islands and seeing how they do things differently, how they're the same. And I think it was this whole idea of that we're all connected in many ways because, what we might call Johnny cakes in Antigua, people in Jamaica might call floats, or people in Guadeloupe might call it something different. And so it was really this whole idea of we all have the same background in many ways. We just might call things a little bit different, but always is back to that core. So
Yeah,
it's
absolutely.
definitely a superpower to have.
Yeah, it's definitely I appreciate it. And that's one thing I'm also just learning, talking like grassroots capacity building, community building, exposure and experiences are just so important to the learning process. Um, but anyway, what does public health mean to you?
Oh man, public health means to me. Ooh. So the way I think I've always described it to folks is really improving the health and well-being of where people live, work, and play. I think oftentimes people, always have this idea of public health. They usually think, oh man, there's the epidemiologist, there's a person in a lab just crunching the numbers, or it's vaccines and that's it. But I always say public health is everything. When someone's like, well, I don't do public health, I'm like, no, you do public health because public health is everything. Because everything that we do in this world impacts our health to some degree, whether it be mentally, physically, spiritually, whatever you might have you. That is public health. And so that's how I've always defined it for myself. And really, this idea of, I think something that's even involved more. Usually, when we have thought about health, we've usually thought about physical health. But I think you mentioned earlier in the pandemic and how people are coping, mental health and wellness, and this whole idea of us as a whole person and our own social environments. That is also public health as well. So that's how I would define it, improving the health of where people live, work, and play.
Yeah, absolutely. And like as you were saying that, I was just thinking about like how public health is in everything, but because it's not emphasized, this is why we have a lot of these systemic problems right now, because public health wasn't put at the forefront. Prevention wasn't like a forethought, it was an afterthought. It's like let's fix it afterwards. So anyway, that was just a little revelation on my part there. So you got your Bachelors of Science in Microbiology in Michigan State University. So what was the thought process going into undergrad for you?
Whew, man, the thought process. So you might relate to this a little bit, or anyone that has immigrant parents or anything like this. Is you really at the time had three options when you went to school: either be a doctor, a lawyer, or some type of business person. And the funny thing about it is, like, neither of my parents were those things, but like that's what they want you to aspire to. And so, I went in like probably many others pre-med. I actually didn't declare a major until I think the end of my sophomore year when I was like forced to. And that's when I did microbiology. I think during my sophomore year, I had this revelation that I was, me being wanting to be a doctor wasn't really my dream. It was my parents and my grandparents' dream. And I guess I just had a moment where I was like, I need to do my own thing and make my own pathway. But I still had to declare a major, and I had taken all these classes. And I had told myself I'm going to graduate in 4 years. So I'm not going to be one of those folks that are going to be here for like 5, 6, and 7 years. I was like, well, I'm going to get my degree. And I can always pivot when I go into my master's. And so I started to fall in love with microbiology, which I don't know why, but it just was fascinating to me. So like my full degree is microbiology and molecular genetics, and I focused in on virology, immunology, and epidemiology. And so, which is all funny that all those things are needed right now in this pandemic at the moment that we think of. But I don't know, it was just interesting. Cells just, they made sense. And I think they, in many ways, represented society on how we think about stuff. And I actually do a lot of kind of analogies of the cell and how we think of public health and systems approach on things being done. But that was really the emphasis on how microbiology started for me. I wanted to stay in the biological sciences since I had already started this pre-med journey, but then really pivoted, said, let me do microbiology. I dropped the pre-med. And at the time, I was saying, I'm going to be, I was either thinking I'm going to do my PhD in microbiology, or I'm going to be a med tech and work at a hospital or work on diagnostic safety, because it just seemed like it was really fun at the time, safe.
Okay, and that makes a lot of sense, you know, coming from the Caribbean background, just wanting to go those kind of routes, and then having that tough thinking process on yourself, like, okay, this is not what I wanted for myself. And I always think back to myself too, because I was on that doctor path primarily because I like biology, and then like it just kind of went down that doctor path for some reason. Then their parents, oh yeah, you know, and they always like telling their friends, and oh yeah, he's gonna be a doctor and these kinds of things. And I had to make that hard decision that it wasn't for me, and the approach that the medical field took, which just wasn't the approach that I wanted to take. So tell me, during your undergrad, did you know about public health, or was your like introduction to public health on the epidemiology side, or how did that come about?
Yeah, this is actually an interesting story. It's funny. Someone had asked me this a couple of months ago, and it ended up getting captured in the MSU alumni journal. So I knew nothing about public health. So once again, I think many folks going into undergraduate degrees, you know, you only know about like the core. I'm going to be a doctor. I'm either pre-law, pre-med, or, you know, you have this kind of other, and no one really thinks too much about that. So I was going through my life trying to say I'm going to be a med tech, you know, maybe do my PhD. You know, at the time, even though I said PhD, I was like, it was more so for, there's nothing else you really do with a microbiology degree other than doing a PhD or working in a lab. And so I was just looking at my options. So my junior year, I'm taking like a microbiology lab, and you know, I'm like, as you can probably see, I'm a little bit more of a social extroverted type of person. And the professor of the lab, literally, you know, she was kind of going around each table, seeing how our experiments were going. You know, she just like was talking to people. She was brand new, first time ever teaching. And, you know, she comes up to me, she's like, Bryan, I'm just really curious, like, what are you thinking about doing? Like, you know, after graduation, you know, in the next 2 years. And I'm like, oh, you know, I'm thinking maybe being a med tech, because I had just come off an internship the summer before working in a hospital, a local hospital here in Maryland. And she was like, she looked at me with this kind of, are you sure you want to do that? And I was like, looking at her like, should I not? She's like, don't take this the wrong way, but she's like, you seem too social to be in a lab all day long. She's like, no disrespect to the people in the labs, not saying that they're not social, but she's like, you really look like you have a skill set that could so much better serve the world and really being out there. She's like, have you ever thought about public health? And I was like, what's public health? And she was like, you know what? You should really take, like, she's like, part of your microbiology degree is you can add a concentration in epidemiology. You know, you should look into taking that epidemiology class, which can give you an insight to public health. She's like, I don't know if you'll like it or not, but, you know, I think you should at least give it a try, because she's like, if you want to go down this path, you know, I support it, but I think there's another option for you that I think would really like just take advantage of your skill sets. And so I'm like, I'm a little discouraged in this moment, like, man, this woman just like killed my dreams. Like, like I had like a plan. I'm like, okay. And I talked to my advisor. My advisor was like, yeah, we can fit this in. You know, you have an elective, you know, do you want to take it? And I was like, yeah, let me get it. Let me take this class. The professor at the time that taught the epidemiology class was Dr. Rip. And he just happened at the time to be the director of the public health program for the master's program at the school. And so I take this course, and oh my goodness, when I tell you, I was like, it was like the curtains had just been like pulled back. And I was just like, wow, this is awesome. I didn't even know this existed. And I think just the field of epidemiology and kind of he definitely weaved in public health into it, all of it. It just made me super excited to learn more. And I had never felt that while I was in my undergraduate studies. You know, oftentimes you just did things because you were good at them. Like I was good at biology, so you know, I just did it. But it's not like you loved it per se. And we didn't give you that fire in your soul. And when I took that epidemiology class, it gave me a fire. And it was one of the very few, I think, classes that I never worried about my grade, in the sense of I just naturally was good at it. And it wasn't even a thought that I would get less than a 4 point. And that's where public health really started for me. And I just really maintained that passion ever since then, into like wanting to learn more. And it definitely cost me much, because I was like thinking, man, I'm about to like rethink my life after. I can't do this PhD right now. Like I can't do a med tech. It would just not be who I am, because once you know, the lights, you know, kind of pop on for that one thing you're passionate about, it's hard to like look at the other things you were looking at in the same light, because it's just like, oh no, they look real dull while this looks real awesome.
Yeah, well, that is truly amazing that she came in and she came in her first class and spotted you, and you're like, and helped you and gave you that exposure to show you something that might be more fitting of your personality, and it did fit, and that's awesome. Like imagine if she didn't tell you that, or no one told you that, and you went down like a med tech route and then had to pivot later on, or whatever the case might be. So just going back to like that exposure is just so important. And I feel like public health, it just no one talks about it. Granted, now it's getting spoken about a lot more, but we just need to keep on speaking about it, and telling people about these roles and positions that they can do in public health. And during your time as an undergrad student, you were a Charles Drew Science Scholar. So tell me a little bit about that.
Yes. Yeah. So Charles Drew Science. So I was part of the Charles Drew Science Scholars Program. And so it is a program at Michigan State University for high achieving minorities in the STEM fields. So it was actually part of the reason I came to Michigan State. You kind of get invited as a prospective student that's actually already admitted. And really, in many ways, it became very much like my family. So, you know, I'm born raised in Maryland. I may have mentioned it or not, but there was this whole idea of going to Michigan State, you know, this foreign state I had never really been to. You know, you don't really know a lot of people. And Michigan State is huge, by the way, when it comes to classes. Like there is over 40,000 undergrads at Michigan State University, and over 20,000 graduates. So like over 60,000 students are at Michigan State at one time. And my incoming class, I think, was nearly 7,000 people. And so the Charles Drew Science Scholars was really it was a residential program, but then in addition, we had like specific classes that we took. And within those classes, we really built a community. So there was about 40 people in my Drew class. And we had our own advisor, which really took the time to get to know you and really think about, you know, what are your goals, where your likes, dislikes. And we also took what they called our NSC classes, which allowed us to hear from different speakers. A lot of the times, the initial program the idea of the program was that you were going to stay in the STEM field. So you had a lot of pre-meds in there, and you had a lot of people that wanted to do PhD in microbiology, you know, physics, whatever you might have you. And so it was a pretty cool program. And funny story about that too, in the sense of it became very much a very close thing in my life. And I'm like so proud of it. So my sophomore year, there was a new director, Dr. Jared Caldwell, which I always call like my Michigan dad in many ways. he and his family have been just so close to mine. So I also met my wife through the Charles Drew Science Scholars Program. So she's also a Drew Scholar as well. So she's 1 year younger than me. And when we got married on Michigan State's campus. And there's an alumni chapel just for alumni. Dr. Caldwell's wife, which is a minister, they both married us. And we had a lot of the Drew staff, the advisor, Ariel, which ended up becoming a really good friend of mine, was part of our wedding. The administrative secretary, we had our reception, not reception, our wedding party celebration at her house. Like we had like a whole barbecue thing for the rehearsal dinner. So it's like Drew Scholar was definitely not just like a program, but one awesome opportunity to meet other Black excellence in a school that was super white, but then also just lifelong friends and really building a family and network. Even though I did not end up going, I guess, in the traditional STEM type of field as they would have liked it, definitely contributing to how I navigated through college and helped me not make a lot of mistakes.
Yeah, and that sounds like an awesome community to be a part of, and it seems like you got a lot of value out of that. So tell me, you were saying that in your epidemiology class, you were in the class with the program director of the master's program. So did you have conversations with him about the master's program, or like thinking about the master's program, or how did that develop?
Yeah, so I was thinking after the class, I did talk to him and was like, hey, I'm interested. They had just been starting up a MPH program at Michigan State through the College of Human Medicine. And I was like, I don't really know what I want to do with my life, and in many ways, like many students, I'm thinking about how am I going to work? I don't want to go into another set of debt, and so I was really looking for convenience. And luckily, the program was at Michigan State. I actually had a job, which this is kind of fast forwarding. After I was about to graduate, I got a job with the Drew Scholars Program. So they, in many ways, also there's another opportunity to get to know them. And he was like, if you're not sure what you want to do, how about you take a couple classes that summer right after you graduate? If you like it and you think you want to continue, then we can just enroll you straight into the program. And that's what I did. I actually took a couple baby steps, did an intro to public health class, all the core classes I think most of us have had to do in our MPH, environmental health administration, so forth. And then it was like, that fall, I was like, this is what I want to do. And then enrolled all the way.
Okay, that's awesome. That's awesome that you took like a teaser of it, or you're able to take a teaser of it and go into it. So going into this, did you have a concentration?
Yeah, so at the time they've gone through a lot of iterations, but at that time they had so many concentrations, too many. So I had focused on infectious diseases and administration. Which I think would probably translate now to, it'd probably be health policy and health management. I think now as a core kind of function, with maybe a little biological sciences there. I think at the time I was thinking, I wanted to stay true to my microbiology. And so infectious diseases was actually pretty interesting to me, and really tracking infectious diseases, especially like HIV, and other healthcare associated infections. And then administration, because I really wanted to get more of a foundation in just how to actually make public health work, and like all the project management side of things and just really executing stuff.
And do you think you got that part of it, like the executing and understanding like the business and making, well, not the business, but more so making things work in public health from your MPH?
Yeah, I think it definitely helped with, I think, exposing me to a lot of tool sets and thinking about it. I was always a kind of a go-getter, I guess you could say, in many ways, but it definitely gave me frameworks to think about and best practices to go about when I'm thinking about implementation. And I think a lot for me, one of the things I've told a lot of folks that I've even mentored in the past is, a lot of your learning, you can learn a lot of things from school, but also the best learning is just life experience. And I threw myself into a lot of different things when I was at Michigan State in my undergrad and my master's, which really were the experimental learning, and getting that feedback feedback and then just building on each and every lesson learned or each and every failure.
Okay. Yeah, no, I think that's important to just keep building on the lessons or the failures. Either way, just keep building. So you were infection prevention and epidemiology department intern. So how did you come across that internship, and then what did you do in it?
Yeah, so I ended up, like many of us that have had to do our MPH, you have to do some type of summer practicum or have some type of, experiential learning experience. And so I actually remember that one. It was actually, I guess, by chance. There was a listserv that was going on, and they talked about this one position. It was to work at Sparrow Hospital, which is a local hospital in near East Lansing in Michigan. And I was like, oh, wow, this actually looks like it can combine my infectious disease kind of piece that I like, and then also the administration piece. And so I applied, and I was like, let's see how this goes. And it was convenient. It was like right down the street. I could take a bus right there. I didn't have a car at the time. So I was like, okay, convenience is key right now. And ended up really, this was actually my first introduction into the healthcare. Outside of being a med tech, it was the real first time of being in the healthcare realm. And while I chose it was really much, I was doing all this med tech work where I was like doing these reports, getting, I'm looking at, Staph aureus or if there's CDI. And I was always wondering, where did those reports go? And then I was looking at the job description. I'm like, oh, all the reports go to infection prevention. And so I was like, oh, well, let's see what they do. And so ended up having that internship for quite some time. And I don't know how much you're familiar with infection prevention, but I got to do a little bit of everything. So you essentially are like the hospital epidemiologist when it comes to all hospital acquired infections. So when it comes to tracking everything to see when there are cases going up, going down, you're also responsible for contact precautions. So for example, let's say someone is suspected to have TB, you need to make sure that, they're in a special room for that. If they have MRSA, making sure that you take extra care when you're going in there, washing of hands. And also the fun part of just telling doctors and nurses to make sure you wash their hands. We used to do a lot of secret shoppers where we would pretend we're like, a patient and then see if the provider actually washed their hand. And we also did flu clinics. So infection prevention oftentimes is in charge of flu. And so they kind of have this really interesting role. It allowed me to go out on the floor, meet a lot of people, talk to patients, but then also have this data piece to it as well. So really fun time. And when I was there, it was during a time where it was a really bad flu season. And so I, in many ways, help them optimize how they put data into their EMR system, electronic medical record, and really streamline how that process would actually go.
That sounds like an amazing experience. It sounds like you got to do a lot of different things. And I think one of the great things of always being able to do a lot of different things is you get to know what you don't like, or you can get to know what you do like. Yeah, so I think it's key to just get out there and get as many experiences as you want, especially in public health, because there's just so many different things that you can do. So you really need to get out there and see what different things to do to see how you feel about it. So I think this was after you graduated, or it might be before, but you were a Ministry of Health graduate fellow for Antigua and Barbuda, and you were also, I think, also a fellow for the Ministry of Health and Social Welfare for the Republic of Liberia, or a graduate fellow. So what, tell me about the timeline of that, and then tell me about that.
So this is at the very end of my MPH. So we all have to do, I mentioned the summer internship, but then we all have to do a practicum, which is usually your culminating practicum. And I did something that was probably taboo in many ways at the time, where actually my practicum is different than my capstone paper, my thesis paper that I would end up writing. I did something completely different, which was focused on tobacco-free MSU, which feel free to ask me a question about that. But then my practicum, when I was an undergrad, I had the hugest regret that I never did a study abroad. Michigan State is known for their study abroad programs. They make you travel all across the world. And I was like, I never did that. And so I got to my master's program. I was like, I'm not going to make this same mistake. I'm going to find a way to travel. And so when I'm trying to think about this traveling arrangement, at the time we had to apply for, there was a fellowship going on around, like a traveling fellowship. And so I was like, Bryan, this is time to shoot your shot here. And so I applied for it. They said yes. And so the hard part was just making an internship happen. And so I like created my internship from scratch. So I mentioned that my parents are from my family culture is from Antigua. And so I was like, oh, maybe I should do something in Antigua. One, it'd be a great time to just really get to know my culture in a way that I have never gotten to do it before. But then two, I can combine it with my own interest of public health. And so this is where I talk a lot about social capital with a lot of my mentees. And this is an example of social capital. So my uncle happened to be the godfather of the chief medical officer in Antigua. And so I called my uncle up and I'm like, hey, Unc, what to do? Like, what can you make happen? And he's like, okay, let me go talk to Dr. Rhonda Seeley Thomas. And, I talked with her. It seems so like long ago, but you have a Skype call with her, during this like minimal times. And of course the connection's horrible. And so we have to turn our cameras off. And so I'm telling her, what I'm thinking about doing. And she was like, I think we could definitely use you. And so one of the things I wanted to do is I wanted to know all things public health. You had mentioned earlier about putting yourself in many different experiences to learning. I had that same drive. And I was like, I want to learn everything about public health. And so my practicum in Antigua specifically, which was about a 2-month practicum, was essentially a rotational program to know all things public health. So really understanding the public health system in Antigua. So I got to work, the first month I worked at the hospital. And so I had the whole rotation was in the hospital. So I got to work in infection prevention, quality, occupational health, HIV testing. I got to shadow the CEO, Sean DeChamps, I think was at the time. I got to work in environmental cleaning. I got to work on the hospice unit. And so I really got to do a little bit of everything you can think of. I got to work with the social worker at the hospital, and really this idea of all things healthcare, public health in many ways, because I consider healthcare a part of public health, even though they may not always think about themselves that way, but really got to know everything. And then after leaving the hospital, I got to work more so in what we can traditionally think of public health. So it was a rotational program. I got to work in environmental cleaning. So I got to do cruise ship inspections, which was pretty awesome. I got to tour at least 10 cruise ships, which by the way is awesome. Getting to go in the engine room and everything, making sure there was no rodent infestations, making sure that they were doing all the quality assurance and improvement. I got to do restaurant inspections. I got to do water inspections. So looking at Antigua has like these freshwater pipes all throughout the island, and we would go to each one of those pipes and check the pH level and the acidity, and just making sure that there was no impurities. I got to even go to the rum factories to actually inspect to make sure that they were doing everything that they were supposed to. And so this was a fun part. And I even mosquito vectors. And the one that took me by surprise is I also got to think about jail public health. And so I actually was able to go into the Antiguan jail and make sure, best practices were being followed. And it was definitely a good example of how I never wanted to go to jail in Antigua, ever. But it was really all things public health. And so my paper was really this idea of a comparative health systems and really thinking about health systems as a whole. Where is opportunity for capacity building? Where are people doing things well? And where could there be better improvement? And so when it came to Liberia kind of came out of nowhere. So my grandfather does a lot of missionary work in Liberia, Africa, and he had been trying to get me to go to Liberia for years, because he just does a lot of mission stuff. And I was like, I don't know, I really don't like planes, and so I'm like, I can do a flight to Antigua for 3 hours, but Liberia is a really long flight. And also I was like, man, that's really pricey. And so he was like, well, I'll pay for your ticket and I will get you an internship in Liberia. And I said, okay, let me add this to my paper. So I ended up, after leaving Antigua, um, asked my advisor and everything like that, can I add this on to my paper? So it was essentially like just another chapter, really. And so I got to go to Liberia, Africa, that wonderful 12-hour journey, longest plane ride I've ever been on. And I got a job with the Ministry of Health because at the time, my grandfather, with a lot of the missionary work he was doing, one of the missionaries he worked with happened to work at the Ministry of Health. And so Reverend Braithwaite was his name. And so when I was there, I got to do something slightly similar but different. They didn't, at the time, they were just recovering from a civil war in Liberia. And so I really, in many ways, they needed really help in understanding all the metrics that they needed to report to the World Health Organization and really thinking about a data system in which to track this. And so I got to, in many ways, get to know from a data perspective, all the things that they were doing that I had actually did in Antigua.
Mm-hmm.
And so I actually created their system. At the time, they needed someone that knew how to use Microsoft Access, and I created their database from scratch. And in many ways, this is pre-Ebola. And in many ways, I think in many ways that it helped in many ways and contributed to their response around the Ebola crisis. And so that was a really fun experience. And so this is like the tail end of like my practicum, and all while I'm doing this in both Antigua and Liberia, I'm writing my actual capstone paper, which is completely different than everything that I'm doing.
Wow. That's quite amazing though. That's quite amazing. I do advocate for people to do different projects for their capstone and their like practicum. Generally because you get more experience that way if you're able to do that. But wow, I feel like you got to experience so many different things in those two experiences, and like comparative healthcare systems, and I think is a huge, like when I took that class for my MPH and just understanding how different countries operate like the healthcare public health systems differently, and you learn all these different nuances and things like that. And that's amazing that you're able to build up Liberia's database for health information. And wow. So tell me, what do you think are your biggest takeaways from those both of those experiences?
Oh, biggest takeaway is one, the United States uses a ton of money that is like they grossly spend a horrible amount of money that other countries that don't have all this resource and treasure can do more efficiently. So I definitely learned ways to optimize care. And one of the things I think I realized very much in Antigua and Liberia and many developing and third world countries is the intersection of public health is more connected when it comes to healthcare, public health. It's all in many ways one thing. While I think in the United States, we have these separations and there's these silos. When you're talking about these countries, you have one minister of health that does it all. Like they're in charge of the hospital, they're in charge of the public health, public works is somewhat what they sometimes call it. And so I'd say the two takeaways is we can do so much better in the United States with the resources that we have. And two, teamwork makes the dream work. I was so impressed with just the teamwork that's done at the in the countries that I was in, that we're now starting to see the impact of teams in healthcare and public health. But I was seeing it there and just how you had to work together. And this idea of really, when I say a team, it wasn't just the healthcare and public health team, but even having this community approach and teaming with community members to asking them questions about their care and saying how we can do better as a system. I think I got to see more of that transparency, which I didn't see at the time in the US. And I think we're starting to get there as we think about community participatory research and patient-family engagement, realizing that we need to actually include the people that we're actually serving.
Yeah, and we need to give them the power to hold the systems and the organizations accountable to the health and everything that's going on around them as well. So yeah, I'm, I'm still amazed by those experiences, by the way. And then, so I'm guessing that the other project you were doing was the tobacco-free MSU.
Yeah, it was tobacco-free MSU. At the time, it was smoke-free MSU, but it was a project that I started while I was in my master's and got to stay on for quite some time. And actually, one of my proudest public health moments is getting Michigan State to go tobacco-free as a university. So you might wonder, like, why that out of everything else I was working on, right? So it's interesting. I had to take a health policy class like everyone else doing their MPH. And there was like this one assignment we had to do. I think it was like our final assignment. And it was like, what's, a health policy problem you want to like solve or something like that. And I don't know why, I was just like really struggling on trying to actually write this paper. And I like reached out to the professor. I'm like, any advice on things? Because I'm like, I did so many random things. I'm just kind of new in this public health realm and I didn't really know what to focus on. And so he had told me, he was like, well, Bryan, is there anything that you just are really upset about from a health perspective that you're just like, there's injustice in the world and you want to correct it? Like, what's something that upsets you that is not being done right now that should be done? And I'm like, struggle. I'm like, that's a good idea. I'm like, let me think about this. And so I leave his office. This is the same dorm I had been living in at one point in time. And once I'm leaving the dorm, I walk out and there's like these 10 kids smoking right there at the door. Normally they're supposed to be the 25 or 50 feet away from the door. They're like right there. And I pass by and I'm just like, ugh, like there's a rule for a reason. Why are we even smoking anyway? Like it's bad for you. We know this because I remember taking my intro to public health class. I'm like, it's bad for you. And I was like, why do we even have this ability for people to smoke on a campus like this? Aren't we supposed to be preparing the next generation? And that got me interested. And then that's actually why I wrote my paper on. And that paper led me to asking more questions at MSU. And I got connected with the university physician, and in talking with them, they were like, yeah, we've been trying to work on this for years. And I was like, can I like write my capstone paper on this? Because I think it'd be really cool. So essentially I wrote the blueprint of what MSU needed to do to become, at the time I said smoke-free, but as I learned more, it became tobacco-free. I graduated from there, and then sure enough, the provost got a hold of my paper. And her daughter, I guess, was working on her PhD in public health. So she kind of got this. And she asked me, along with several other stakeholders across the university, to be part of this kind of exploratory group to thinking about what it would look like for the university to, go in this direction. So they actually sent us to Kansas City. There was a tobacco-free summit at the time with all the schools that kind of get together and share best practices. And we essentially wrote a whole entire proposal of like, what were lessons learned and what could be applied to a university like ours? Because our university is so large, it's like, I think the 9th largest university in the United States. So it's a really large campus. What are unique challenges that we would have to think about? And from that report, a task force was created, and I got to stay on that task force until August 2016, when MSU ended up adopting a tobacco-free university policy. If I was in my office, you would have actually seen there was a big plaque that the provost gave me and many of the other founding members of the task force, just kind of in honor of like, it was the first signage of tobacco-free MSU. So.
Yeah, and that's awesome. And it's crazy that it all sparked from your professor saying, what gets you upset as a health issue?
And I was like, yeah, him and I are still pretty close. He's retired now, but I always tell him he's a main reason for why I ended up doing that. And the irony of all of it is he was a smoker. And he was a smoker at that time. And so it was and he was like, Bryan, in many ways, you like got me to quit smoking.
Wow. And I just want to say, like, that's a key tip for any public health student out there. There are like opportunities on campus to do different health projects, and if you reach out to the right people, you'll get support. You might be able to get into a conference, get to be part of a task force. There's so many opportunities out there when you put yourself there.
I know it's even to that point, one thing I remember hearing from like the health team at Michigan State is like, yeah, we can push some things, but when students start pushing things and they can build coalitions, the university sometimes listens more. It doesn't just become that silo of, oh, we're the health people and we're just, and kind of like reminds you of public health. When the public health people talk about it, no one's always ignoring us, but then when everyone else realizes it's a problem, all of a sudden it's like this big issue. And it's like, we've been telling you this for years. And so I think it really, to your point, it's really important for students to really tap into what are some of the problems and pinch points that universities or their local health department is going through to find out where they can make impact.
Yeah, absolutely. Great advice, great story, great insights there. So you graduated and you got your job as a prevention initiative epidemiologist at the Michigan Department of Health and Human Services. So what did you do in this position?
Oh wow, I forgot how long that title was. So usually I just always used to call it an HAI epidemiologist, which is a healthcare associated infections epidemiologist in many ways. And so yeah, after it's funny, I got that job actually while I was in Liberia, Africa. I interviewed for it while I was in Liberia. And I actually, in many ways, got it. This is the importance of keeping good relationships. The internship that I had working at the hospital, working as a infection preventionist, the person that was my boss happened to be on the advisory committee for the state's infection prevention unit, which was called SHARP. A very long title. I'm not even gonna say it. And once again, I go back to this whole idea of, where does these reports go? So I told you I worked in the lab and then I got into infection prevention. So I was like, where do all the infection prevention reports go? They go to the state. And so I was like, oh, let me get a state job. And at the time, what was that one movie that came out? I think it was the one with Lawrence Fishburne in it. It wasn't Outbreak, but I feel like we all had to watch it as a movie. But that movie, I think it was called Contagion or something like that.
Yes, that's it.
And at the time, it made epidemiology look like the coolest thing in the world, and I was like, I want to be an epidemiologist. I'm like, when I'm done, I'm going to do that. And so I'm like, okay. At the time, I was just looking epidemiologist. I want that job, and so I got this job, and although it was a great learning experience, I'm gonna be frank with people too. I hated that job so much. It was the worst job I think I've ever had in my life so far. Mm-hmm. And I think you said something earlier about, through our experiences, we learn. This is a moment where failure was my greatest mentor. Mm-hmm. I learned so much. And it wasn't bad because we weren't doing good work. It was bad for a couple of reasons. One, I had a really bad boss, and I think we don't always talk about that. I had a boss that in many ways was a little bit sexist, racist, every ism you can think of. I wasn't from the state originally. And so just working with a boss, and sometimes it just, that was just a bad fit. But then two, I realized I was behind a desk a lot. And once again, I started thinking back to that one professor I had, which was like, you need to be out there. You're a social guy, like you need to be out there working with people. And I didn't really get the opportunity to work in that job. And in that job, I didn't really get the opportunity to really be out. And so during that job, I had a lot of deep reflection. But at the same time, I enjoyed some of the cool things I did. I actually did two really big things there. But in this role, I was the epidemiologist for our MRSA and CDI work. And MRSA stands for methicillin-resistant Staph aureus. Many people might be familiar with like staph infections and stuff and skin infections. But I also got to be the epidemiologist for our CRE initiative, which stands for carbapenem-resistant Enterobacteriaceae. And you're like, what is that? It's like the worst thing you can get in a hospital. So carbapenems in many ways are like our nuclear bombs of antibiotics that we use. They're really broad spectrum. And when you use them, whatever it is gets killed. So when something's resistant to that, that's really bad. Mm-hmm. And usually you see this in long-term care facilities where people have been having a ton of antibiotics pumped into them to the point where they're just resistant to everything.
Mhm.
And so I actually got to be on a paper, which was actually the first CRE surveillance system in the United States, and really contributing to putting that work together, creating their database. So kind of a little bit of what I was doing in Liberia, but really rethinking how we thought about data. Oftentimes when we look at data, we're looking at these rates, they go up and down. And I think public health at the time, it was always in that. I, at the time, wanted to experiment and say, how can we reframe this into really making change happen? So instead of like, it's 1.25 per 10,000 people impacted by this, how about we just say the numbers? There was 10 people harmed in your hospital due to MRSA.
Mhm.
And let's talk about costs. It cost you $80,000 to treat those on average, those people that had MRSA, where if a hospital is doing really good, you prevented 10 patients from being harmed by MRSA. Really reframing and knowing that language has such an important piece. So I learned a lot from that job, both for good and bad, how to deal with a difficult boss, but then also how do you reframe the conversations to really make impact happen.
Okay, yeah, and that's some great insight, and it's always good to, well, it's not always good, but it's good to know that you know that you don't like what you're doing, and at least you were able to pivot out of that. So when you were in this position and you were doing this deep reflection, and you knew that you wanted to do more like work with people, what was the thought process for looking for jobs? Like what kind of jobs were you looking for?
Yeah, so I was at the time, through that reflection, I've told a lot of students that I've mentored over the years, I was really looking for what gave me joy. Like, what are the things I'm good at? What are the things I'm not good at? What are the things I like doing? And what are the things I don't like doing? And then further, what's the culture that I want to be in? What are the values of that organization? Is it values that I like vibe with? And then are there people that inspire me there? And does the leadership inspire me? And so I was doing a lot of walks because my boss was stressing me out so much. I would like take walks during lunch just to like clear my head. But during those walks, I would think about, what do I really want to be doing? And so when it came to looking for a job happened to once again plop in my lap, where one of the members that was on the advisory board for our unit worked for the hospital association in Michigan. And him and I always sat next to each other during these advisory meetings. And so him and I ended up having a really good relationship. And I noticed when I was looking for jobs that there was a there was an epidemiologist job at the hospital association working with this, but it was more active. Like the job wasn't just in the doing numbers, but there was this idea that you would have to travel. And I was like, oh, that's where I'm wanting to be. And so yeah, I applied, and once again, social capital is really important. I was part of like a men's group out of my church. And one of the guys in my men's group happened to work for the governor at the time. And I was telling him I was like struggling with, looking for a job that, gave me joy. He was like, hey, I know the lobbyists at the MHA really well. Do you want me to just like give you like, a big kudos? And I was like, yo, do that. I did that. Everything came down. I got an interview for that job. And I literally was just like, okay, cool. So I go into this interview. I do the first interview, and there's two guys interviewing me, and I ended up they didn't even ask me anything about like my skill set. The first question they asked me was, tell me what wakes you up in the morning. Like, what activities do you like to do that wake you up in the morning? And that had never been my experience with a job interview. I'm like prepping for this job interview, like, okay, memorizing my resume. And this man asked me a like completely left field question. And I was like, and I just went going. And then he was like, tell me about Liberia and Antigua. Like, what was that like? We were talking nothing about the job itself. He's just asking me about my experience in doing these, and actually similar to a question you asked, what are the takeaways from those moments? experience. And so we're talking, and he was like, man, I just love your story. Keep in mind, this whole entire interview, not one peep of my skill sets whatsoever. And so I leave that job interview feeling very strange, like what just happened here? Like this is weird. And I knew nothing about, and his job was like really like, and so I'm just like, I leave not knowing. And so I get a call from him, and he's like, I have good news and bad news for you. And I'm just like, damn. I didn't get the job. Okay, yeah. He didn't have to call me about this, right? It's like, the bad news is I don't think you're going to be a good fit for the epidemiology job. And my heart, I remember, just sunk. I was like, damn. He was like, the good news though is I think you're selling yourself too short. I actually have a project manager job that I think you would be a better fit for. Which was higher than the epidemiology job, because he's like, you just have a really good worldview about things, and I need someone that has a big picture idea of how things are interconnected. Would you be okay if we had a second interview and we interviewed you for that instead? And I was like, yeah, sure, let's go do this. And so that second interview was just amazing. And once again, it really wasn't about my skill sets, but it was really more about like, what were, the lessons learned throughout my life and this and that and my different experiences, and ended up getting that job. And that paid me way more than I had thought I was going to get in any other job, which also reminded me to never sell myself short when it comes to my salary.
Yeah, absolutely. That's something that we often do a lot of the time. So that's awesome. And wow, like relationships, always relationships are just so key and so important. So what did you do in your project manager job?
Yeah, so I was working for the Michigan Health and Hospital Association, and I was a project manager for our patient safety organization. And a PSO, which is kind of the abbreviated version of it, is essentially, not to get over technical, but essentially all the errors that happen in healthcare kind of get reported to this PSO, which kind of protects that data. And it allows people to have psychological safety to say, I made a mistake. I want to send this mistake to you. And maybe you can analyze it along with all the other mistakes and think of themes that might be coming from the data that might help with process improvement for patients and families. And so this database I was managing had like over 300 cases. And so you had actual harm that happened, but we also had near misses. Near misses are harm could have happened, but someone just happened to stop it, but they still reported it anyway, because that's some learning that can happen. And so I got to work on a hodgepodge of different activities, health IT issues, medication reconciliation issues, wrong site surgeries, medication errors. Like, it was really fun. Like, I had a blast, and I got to, my boss was just an amazing guy, Steve Levy. In many ways, he like unlocked who I was. And when I told you I had a bad boss the first time, this is like one of my favorite bosses on the other side of it. And just great mentorship as a whole. Like, at the time, you probably laugh at this, I was like really bad at public speaking, and I was like really nervous about all things public speaking. And I was telling him like this in our improvement plan. And so he was like, you're bad at public speaking. Okay, I have an idea on how to fix this. And I was like, what? He's like, I'm going to have you present to the board and ask for $250,000 for this new project that we're trying to do. And I was like, wait, what? He's like, yeah, it'll be great experience. Don't worry, I'll be right there behind you. You got this, right? And I remember I'm like sweating bullets. But weird enough, ever since that moment I did it, it's like I had gone through the scariest moment in my life. And after that, like, I was just amazingly good at public speaking, or at least not as nervous, because I was as nervous as I could have ever been in that. And so he was just a really good mentor in that. And I also got to do this one thing called safe tables. So I got to travel to all 132 hospitals and kind of did more of a regional approach. And I would facilitate conversations with healthcare providers around when mistakes happen, what were lessons learned, from that. So really much ways that part of getting out, being out there in the community and being out there and talking to people, that was something that gave me so much joy. And I got to work with thousands of providers, really being in this safe space. It was like a group therapy session of like, yeah, I messed up on a patient, and there was such shame I had, but this is what I learned from it. And this is how I had that conversation with the patient. And this is how I disclosed what I did. And so it was just a really great experience. And while I was there, and my role kind of shifted a couple of times while I was there during my tenure. So I kind of switched to the quality and safety side of things after about maybe a year and a half. And in that, I got tasked with a lot more our large scale regional statewide initiatives. So I oversaw our CLABSI, CAUTI, MRSA, CDI. I started our health equity work. This is starting health equity and the idea that, hospitals and healthcare have a larger role to addressing social determinants of health. And we need to realize that. And this is back before it was sexy for people to talk about it. I also got to work on our readmissions work, our pay for performance contract that we had with Blue Cross Blue Shield of Michigan. And so I really got to throw myself in working with large scale collaboratives. In many ways, if you could say how I identified myself in that role, in all of those roles, I was like a therapist, a coach, a motivator, a cheerleader, and really a technical content expert. And so I really got involved so much with kind of the healthcare realm and understanding how healthcare works, understanding the aspects of patient safety and quality as a whole, and even advocacy.
Okay. And yeah, that is quite a few different roles and different job duties in these roles there. And I feel like it just speaks to the breadth of work that you've always done throughout your career. You get into these roles where you're doing like a bunch of different cool stuff. So that's awesome. So after this, you went on to get your Doctor of Public Health at our Harvard T.H. School of Public Health. Did you, when you were in your master's, I know earlier on you said that you want to do your PhD, or you were thinking about doing your PhD. When did the thought process of doing your Doctor of Public Health come to mind?
It started in my master's. So my grandmother would always tell me this quote, education is one's passport through life. And so as you've heard me say, I've been doing all this other stuff. I'm like out here. She always looked at life being, you should always be a lifelong scholar and constantly putting yourself in new positions to learn and get your stamps on your passport. But my grandfather, my paternal grandfather would always say, the doors of opportunity are as wide as you qualify for them. And I realized some of the impact I was really thinking about making, a lot of times you needed a doctorate to really make some of those changes, not necessarily because people that have doctorates are so much smarter, but it's just this hierarchy that we have in our system where you have to have this degree to show that you're credible. And it just happens to be way faster when you do it that way versus if you're in your master's or undergrad or whatever. And so the DrPH idea started actually with that same professor I mentioned before that got me kind of riled up about tobacco-free, MSU. He had said, I told him what I was thinking about career, and he was like, I was like, I don't know if I would want to do a PhD in public health. I'm really loving the kind of doing the work versus just really kind of discovering new knowledge per se. And he was like, well, have you ever thought of a DrPH, a doctor in public health? And I was like, what's that? And I'm learning from him. And the only reason he knew a lot about it is he was a DrPH ABD, all but dissertation. And he was like, this is like the intersection of health policy, advocacy, and really management and just leadership as a whole. And he's like, I see leadership in you for the future. And he's like, this might be something you want to explore. So when I was looking at all these DrPH programs, they all wanted years of experience. And so I had made it a concerted effort right after I had graduated to literally build myself to being the best applicant when the time came. And so I had a really great mentor that would tell me every month or every other month, you should be adding something new to your resume, your master resume, whether it's a conference, a talk you do, a paper that you submit, a bullet point on your job duties, a training, whatever it might be, you should be actively, literally building yourself up for success. And he would say, Bryan, if you're trying to do it for your DrPH, it's a win-win situation, because if you do it really well, you make yourself the best possible applicant. But if you don't really decide to do that, you become the best public health practitioner out there anyway. And so he's like, you win either way. And so I had been building, whether it be volunteering with the American Public Health Association, the Michigan Public Health Association, which I was part of, Tobacco Free MSU, and being on that task force. I was always doing something new. And in my job, I was always trying to do a new training, whether it was getting my lean certification in healthcare, my change management certificate. You know, I was always doing something and getting new degrees and new knowledge. And so that brought me to the 2015, 2016 level. And like many people, I saw where the politics of life was going in the national politics and the presidential election. And I was like, you know, Bryan, this is a good time to, like, you know, apply to school. You know, and during my times of going to APHA, I had like been talking to the schools and getting to know the programs and really thinking about which 3 programs. I decided to choose 3 that I wanted to do, and studying for the GRE all over again, which was torturing. And that's really what kind of got me into, you know, let me shoot my shot now. My wife I'd already been married at this point now for about 2 years or so. And my wife was like, you need to probably do this before we have kids. So go do this now. So I remember talking to Vincent James. He was the one of the admissions directors for Harvard. And I remember thinking to myself, you know, Harvard, I loved their program. It was very cohort based, but like many Black Americans, you know, there's that imposter syndrome where I'm not good enough for them. And so it actually wasn't even my top school, and I put a lot of effort in. It was my 3rd. At the time, I was looking at other schools, both DrPH programs, but I remember one thing Vincent would tell me. He was like, well, Bryan, the only way that you don't get into Harvard is by not applying. That's a guaranteed way. And so I was like, fine, Vincent, I will do this. I'll put my application in. And sure enough, you know, I got an interview, a second interview, and somehow through an act of God, they were like, yes.
Awesome. That's amazing. That's amazing. And I'm glad that you got in and that you took the opportunity to fail, and you were able to not fail and actually thrive and get in. So what do you think was the what pushed you to choose Harvard over the other schools?
Well, the first school that I had applied to said no, so that made life a little bit easier. They were the first people to say no, and they were like real quick. And it's funny, that was a school that I had put the most energy and time in. I talked to students, faculty, like I knew everybody, and they were the first people to be like, no. I had like researched all the professors I wanted to work on with them on projects. No. Harvard was the first school to say yes. The other school that I applied to, their application was later. And so I didn't know I don't even know if I got into that school or not, because at the time Harvard had already come and they were unwilling to give me an early decision at the time I needed to make my decision for Harvard. So if one has the option of Harvard or this other school, which is not prestigious as Harvard, I chose Harvard.
Yeah. Don't get me wrong there at all. Fair enough. Okay, so during your time at Harvard, you had a fellowship with the Prijna. Is it Prijna?
It's Prijna.
Prijna Leadership Fellow and Julio Frank Fellow. So tell me a little bit about
Julio
this
Frank.
fellowship. Julio Frank.
Yeah, so Julio Frank Fellowship was based after Dr. Julio Frank. He was the dean of faculty, essentially the dean of the School of Public Health for Harvard for a couple of years. And before coming to Harvard, he was the Minister of Health for Mexico and really helped build helped address those that had lack of insurance in Mexico. And he's kind of credited for the Mexico system to addressing insurance. So some friends and colleagues actually made that fellowship, and it was specifically for the DrPH program, which was one of his pet projects, I guess you could say, that he started. So he was the one that was very instrumental into starting the DrPH program at Harvard School of Public Health. And so I got that fellowship right off the bat, and it actually helped with like reducing like 50% of my tuition, which made it a little bit easier to say yes. The Prijna fellowship was based off anonymous donors and Prijna, it's a Sanskrit word that means ultimate wisdom through one's surroundings. Sounds kind of like me, right? Like all that you're absorbing, it's really building that ultimate wisdom. And I actually got that in 2018. It was like 2018. It was like my second year of my doctoral program, and it covered my second year and some more, and also my first year. And so that was a fellowship that was really given to me for leadership potential, and it's given to a couple of students within each DrPH cohort that look like they are going to. They really take this whole idea of full experiential learning and are going to be great leaders in the future one day. So I'm pretty fortunate and happy to have been blessed with such generosity from donors that really definitely helped remove a lot of the anxiety and allowed me to really do more at Harvard without trying to like think about the job to pay all this debt, and really take the Harvard experience to a whole nother level, whether it be me working on research projects that I didn't really have to think of, was I making the money I needed, but was it something I thought was impactful? And even being the president of the Harvard Graduate Council, it definitely just gave me a lot of opportunities to do some cool stuff.
Okay, and we're not gonna just walk over that one. So tell me about how you got into the Harvard Graduate Council. Why do you want to run to be in that?
Yeah, so the Harvard Graduate Council, I'm the student body president for all the 12 graduate schools of Harvard University.
Mm-hmm.
So I am the student body president for that. So when I first got to Harvard, the School of Public Health, I wanted to really start. I looked at this as an opportunity to grow and do some things that I was a little hesitant to do. So I'd always wanted to get more into advocacy work, but I didn't want to fail. So I'm like, okay, it's a little bit safer environment while you're at school. And so first, I actually became the VP of student advocacy at my school, working with our local Harvard Chan Student Association, and that really got me to understand how to listen to people. And really advocate for their needs. And this made me understand the bureaucracy of higher education, which I think those lessons have continued with me understanding the bureaucracy of the government as a whole. After that, I had my second year, I was like the Harvard Graduate Council representative. So think of like the House of Representatives. I represented our school to the Harvard Graduate Council. And because I had this fellowship and I wasn't really thinking about funds, I thought, I had always been one of those kids. I told you I was really afraid of public speaking. And I think I just never really believed in myself. I think just being that Black American, we're always constantly told we're not good enough. And I started listening to that voice in my head too long, where I was like, Bryan, believe in yourself. And I was always like the guy that wanted to be the VP, but never the president. So I was like, you know what? Let me go out here and do some presidential things out here. And I ran, and I was selected like unanimously, which was pretty awesome. And really reworked, redesigned, reimagined what the Harvard Graduate Council looked like. And so I was one of the first people to get $30,000 from the provost to literally create a catalyst fund, because I wanted one of the big things that Harvard's always trying to do is to bring the university together and create a culture of belonging. And so I learned a lot from like some of the other work I did around payment models. I'm like, well, let's incentivize people to have this sense of connection. So if I have all this money, how about I like tell people the only way you can get this money is by really joining in across the different schools, which were in many ways sometimes a little siloed. This created an atmosphere for them to at least try to work together. And so it was a great experience. I got to learn, I got to talk to, build a really great relationship with President Back O, the university president. I got to be at his inauguration, because he came in as president when I was there. If you actually look at his inauguration online, I'm actually in the back row at the corner, right near the seat he sat in. And then it just got me to understand even the public health side of how healthcare runs at a university, because I got to be on the board for the health insurance, student health insurance. And I also was president during COVID. And so really was the early steps of COVID and how we as a student body were going to address it and what was important to us. It really allowed me to really implement a lot of key initiatives and partnerships that still have dividends today as Harvard and many other universities are going through this pandemic.
Okay, yeah, that's awesome. So, and you also had you were a health management summer consultant for the business consulting group. So how do you go about getting that, and then what did you do in it?
Yeah, so this was an internship at Blue Cross Blue Shield of Massachusetts, and so they have like their own internal business consulting group. So it's not BCG like the actual consulting group, but really an internal unit within Blue Cross. And so I would say the key thing is making the people at Career Services your BFFs. I talk to them, and like many universities, they're always trying to connect with alumni and different programs. And for my doctoral project or my doctoral degree, we also had to do a summer immersion, along with many of the other immersions we had to do. And so I applied for this early, and I wanted to do something different. So I mentioned to you, I was always going up the ranks of understanding, right? Lab to hospital to state health department to hospital association, where I'm doing the work. While I was at the hospital association, I told you I oversaw a lot of our pay for performance. So I really got fascinated with healthcare finance. And so I was like, what would it feel like to work at a health insurance company and really understand this more full spectrum? And so did my research on them, applied. It was an intense interview process. So the first time ever, it's this new thing where you record your interview with them. You're like looking at the screen and you're answering these questions. And I remember I'm sweating bullets because I build energy from looking at people. And I'm like, I'm just looking at myself. This is awkward. But they brought me in for a second interview, and then a third interview. And then the fourth interview, I actually had to do a presentation of a past project I had did. Because they really wanted to see your thinking of how you solve problems. And it was a really great opportunity. And while I was at that position, one, it paid really well. And I always say, always look for internships that can pay. But two, it allowed me to work on some really meaningful projects that helped me think about how to start a project from beginning to end. Because even during the internship, we had like all these other classes we took to understand how health insurance works, how to do project management, how to do engaging presentations, understanding all the different change management modalities, because they worked across the whole entire company working on any project. So any project any leader had, they would work on. And I got to work on two really awesome projects. One was reimagining case management. And I actually was able to do stakeholder interviews and really looking at how we could optimize case management and build buy-in from the leader. But then two, I got to actually work on a payment model, which it was at the time, it was top secret, which was kind of cool, where it was a partnership that we had with another health system in Massachusetts to really look at lowering costs, increasing population health and patient experience. And I got to do some project management for that, which is really cool.
Yeah, and that is an awesome opportunity, especially like an organization with like Blue Cross Blue Shield. I feel like they have a lot of different ways that they are plugged into the health realm, and I feel like being a consultant, you also get to work on a lot of different cool projects. And as you said, you got to learn how to take it from beginning to end, and that's something that we don't always understand in public health, or like just going through our master's program or whatever the case is. We might be only have like a theoretical knowledge, but not actually doing it in the field. So that is invaluable. So what do you have any other big takeaways from your time at Harvard and your DrPH program?
Big takeaways. social capital is king. I mean, I think that was one of the reasons I went. I wanted to make sure that I got to every professor I think I ever had. They know me by name. And I think it was just really cool in building those social connections because they led to so many other things. Even my dissertation, which I ended up staying with Blue Cross Blue Shield, working on home-based palliative care models for the state. And so I really got to just like all these relationships. Relationships are so important. And Harvard, I think, really emphasized that. And when it comes to the DrPH community, I love my cohort so much. Like the one thing I loved about the DrPH program at Harvard is it really was a cohort model, and we're like a family, and we're still on like a WhatsApp chat. We talk every week. We go to each other's defenses. It really is a family. And it was actually the genesis of us even creating the DrPH Coalition, which is a group that we actually filed. We're an official organization. I sit on the e-board for that, for all DrPHers across the nation to really build a sense of community. And that all started while we were at Harvard because we realized how our experience there, we wanted to share that experience with others.
Yeah, and that's awesome. And I just think collaboration is huge, and especially I feel like DrPH programs are positioned to do a lot of good work in public health, especially with that leadership aspect of it, and like the project management part of it too. So that is definitely some key information. And yeah, relationships are just key in so many different things in our lives. So that's for sure. Then after this, you're a research fellow at the MedStar Institute for Quality and Safety. So you can talk about how you came across this and then what you did.
Yeah, so that's my current role right now. Once again, I think I've echoed relationships matter. And so I got this job in also a weird way where I mentioned I do a lot of work with the American Public Health Association. And this was around the time I was starting to ascend to be the chair of the Community Health and Policy Development section. And I'm welcoming people at APHA, and this is why, organizations like, whether it be APHA, whatever organizations you're part of, social capital and building networks are important. I'm happen to talk to this woman at the table, and we realized we have this commonality of Michigan. She worked at the MHA, and when I asked her, man, you worked at the MHA, like, why were you working there? She's like, oh, my mom founded the Keystone Center, which was the center I had worked for all these years. And she was like, I was like, wow, the chances that I meet the person's daughter that actually like started this. I'd heard of her name, but never the founder, but never had met her. And she's like, oh, you should talk to my mom. And her mom happened to be working with MedStar Health at the time. And so we got in touch, and she kept in touch with me. And it's important, I think, of any lesson to learn. Keep relationships alive. Like, don't just make them a one-time talk. But I had it on my calendar, talk to her once a year at least, and catch her up with everything I'm doing in my life. And right in 2019, I'm getting closer to graduating for 2020. I reached out to her, and she was like, hey, I got some news for you. I was like, what? She's like, I just got a humongous multi-million-dollar grant. I want you to come work here at MedStar. I think you will be great for MedStar. And she literally like plucked me early before anybody else. I remember there was a lot of reflection talking to my wife of if we wanted to move back to Maryland. And so, got that job. It was offered to me actually pre-pandemic. So this is back in January. And negotiated when I started and some other things. And actually, right after my defense in April, I consulted with them. So I could, they couldn't pay for moving expenses, but they could add me as a consultant, which I could contribute to the work and get an idea of what I'm going to be working on. And then when I moved here in May, started the job in June full time. And so I've been doing that and been able to do a lot of amazing, cool projects. I'm under her grants, which work on diagnostic improvement. So when you think of your provider, how do they see themselves as a team in addressing patients' diagnosis, and really how do we build capacity there? But then also I have another project which I work on diagnosis for cardiovascular health for women. And there's a lot of differences and disparities between men and women around cardiovascular health. And so really looking at that. And the big project that I've been working on and continue to work on is actually a COVID-19 project in which I'm the program director for, which is actually working with about 110 nursing homes in the region of Maryland, DC, Virginia, on COVID-19 management, prevention, and really just care for residents and their families, and really being a coach and a supportive, creating a learning community for nursing homes to get understanding on quality improvement, but then also understanding ways that they can optimize their system. So I've been working with nursing homes each and every week, and that's been kind of like my COVID project that I think a lot of us have been getting.
Okay. Once again, that's great that you're just getting the relationships out there and getting the opportunities through those relationships. And it always seems like you're doing a lot of different things in your roles. And I feel like that's why people will probably continue to want to have you in these roles, because you're able and capable to do a lot of good things in a lot of different aspects of the organization. So you are additionally an assistant professor in medicine at Georgetown University School of Medicine. So how do you go about getting this?
Yeah, so the thing about MedStar, so MedStar Health, I probably didn't say this before, but MedStar Health is a large health system. It's the largest health system in the Mid-Atlantic area. So we have about 10 hospitals. So many people are familiar with like Georgetown Hospital or Washington Hospital Center, which are like two flagship hospitals in DC. MedStar owns those. So very large health system in both Maryland, DC, and it has actually the largest physician provider group in the nation. And so I work specifically with their Institute for Quality and Safety at the more of the corporate level. But also MedStar has a partnership with Georgetown University. Since MedStar is just a health system, they partner with Georgetown to be an academic health system. And so many of us that work in kind of this intersection, and that was actually part of my negotiation with my boss, that I wanted to make sure that I had that faculty appointment. So I specifically, and it was fortunate that the unit I work in, MIQS, has a program, a master's program. So I actually teach for their master's program, their executive master's program in clinical quality and safety leadership. And because I had all this leadership experience from before for my DrPH, I actually teach the last class, creating and leading change in healthcare, based off of all that experience. And in many ways, it's a reflection of everything I've gone through, but then also being able to pass down to students the different ways you can make change happen in healthcare as a whole. So I was fortunate to get that faculty appointment last year. And actually, I just finished teaching last week. And so I teach usually one class in the spring and then one class in the fall. And so really that intersection of healthcare and academia. So good, nice partnership.
Okay, yeah, that sounds great. How do you balance doing that as well as your other job? Is that difficult?
It can be difficult when you're teaching. So my class is like 6 weeks, and so it's not part of your normal day-to-day job. So it's I kind of do that all after work, and so you just know that's just going to be a busy part of your life. And planning is key, and just making sure. But we have awesome students. It's a smaller program, at least for me, where I just have about 5 to 10 students. So it's a really nice, intimate program in which I can really build those relationships. So it doesn't feel necessarily like you're doing a lot of work outside of the grading piece of it, which I don't always like, but you really get to know the students, and it feels more like a coaching relationship since it's an executive master's program. So many of the people that I am even talking to, some of them are doctors, nurses, public health practitioners that have a lot of experience, and in many ways I'm walking them through this journey with them, and I'm their culminating class. And so it's really more of a lot of it is around reflection and giving them tools for the future.
Okay, and if you had to give one tip or two tips or a couple of tips on leadership, what would they be?
Leadership, ooh, that's a good one. Tips on leadership: one, change happens at the speed of trust. And so as a leader, you need to build trust. Trust is very easy to lose and very hard to gain. So just always remember that. Two, always think about ways that you can align your interests with others' interests. And three, have a passion for whatever you're trying to do, because people follow people that they think have a mission. And so you should be a living embodiment of whatever the change you're trying to implement, not just something you're doing, but really truly believe that this world needs to be better and you are really trying to advocate in that direction. People follow people they trust.
Absolutely. That's a great 3 points of advice there. So where would you like to see yourself in the future?
Ooh, that's a good question. So I don't know, wherever I end up going. So I have like, many people know me that know me really well. I have like a mission statement and vision statement for my life, which I've been thinking about forever. And I really cultivated a lot while I was at Harvard. So my North Star, which is your vision statement in many ways, is for me to be a nexus of change through my blessings, failures, and community. So I always like to be in that intersection, that gray area, and I don't know where that goes. And my interests change sometimes, but knowing that I have been super blessed and how I can build on those blessings. I've had a lot of failures. And as I said, my failures are my best mentors. And really, this idea of whatever I do, I want to be in community with others. And so, community is very important, just not from a cultural perspective, but all the work we do in public health and healthcare. But then I also have my kind of mission statement, which has been the mission statement for the past 2 years, which is to use my talents, my authenticity, my talents, my privilege, and my networks to empower individuals and organizations through listening, reflection, and framing with an eye towards action. So in anything I do, taking advantage of those talents, my honesty, and my networks, and the privilege I have of even being a doctor of public health and graduating from Harvard, to make sure that I do make a change in the world with those talents, and really looking at ways I can coach individuals. And coaching is really something that's important to me, and having a role I can do that, but also making social impact, because we talk a lot of things in public health and in healthcare. I want to be in this space in which I'm actually doing that hard work. That requires listening to the people that really matter, our patients, the community, reflecting and seeing where my own biases are and where I need to check myself, and then framing everything towards action, because we oftentimes come up with great plans, and collaboration is not just sitting at a table, it's actually, doing work together.
Yeah, absolutely. And I like that. And I look forward to seeing how your career, your life unfolds into the future. So moving on to the last section of the show, the Furious Five, 5 questions I ask all guests. Number one,
Yeah.
what advice would you give to a student trying to pursue a career in public health?
3 pieces of advice. It's kind of actually my mantra, so I'll make it simple this way. I always like to tell people, be curious, be hungry, be humble. So be curious. Always ask yourself why in public health. Why are we doing the things that we do? Every system is perfectly designed to get the results it gets. Ask why those systems exist. Second, be hungry. You should find out, what is the problem you wish to solve in this world. Don't ask what your career is or what job you want to do. And I think I learned that very much from my earlier story. What problems do you want to solve? Because that's how tobacco-free MSU happened. What problem gets you angry, makes you livid, and you want to see a change happen? And then last, be humble. Know that you cannot do this work alone. It requires networks, it requires community, it requires collaboration. And so know that it is important for you to build that social capital to make those changes that you want to see happen.
Absolutely. Great advice. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
My position, that's a good one. I would say the advice I would give is talk to a lot of people, because probably even from this talk, it wasn't like a straight line. I got here in a very serendipitous way. And so don't look at people thinking that they got there just by doing X, Y, Z. Know that it is definitely a journey. And so talk to as many people as you can to find out what are the skill sets, the expertise that is needed. And one of the things I did was looking at all those job resumes. Even if you don't think you're good for it now, keep it, copy it, and start looking for, what are they looking for? Are they looking for a doctorate? They're looking for these skills, and then work your way up to building, to that I said before, with building your resume to really highlight all of those strengths that you have in being the best applicant.
Absolutely. I tell people to do that all the time. Have you looked at job applications? Because that has invaluable information for like what skill sets you need going forward and what you should try to build towards. So absolutely agree with that. Number three, what's something you're working on improving in your life right now?
What I'm improving in my life right now is right now it's my health. I mean, I think during the pandemic, we all have the ability to sit down here. So I've been getting super actively engaged in cycling and just really getting into a routine as a whole. As I'm getting older, I'm like, I need to actually start exercising, and being cooped up in the house is not healthy. And so how do I think about my mental health and also my physical health? So cycling is something I'm getting into, and that also gives me a lot of perspective to start reflecting, being out in nature, to think about what are the next steps I'm going to do to try to make impact in public health.
Yeah, definitely. That stillness, that still time to really reflect is so important. I've found as well. Um, Number four, professionally, do you recommend anything?
Professionally, join groups, take advantage. So let me say, first one, join groups. APHA has been a really good family for me, specifically my CHPPD and health administration folks. Boop, boop. And also, I'm also part of the American College of Healthcare Executives. But find whatever group it is, whether it be local or state or national, whatever it be, find your community, find your peeps. You need to find your public health peeps. And two, I would say never stop learning. Many of the jobs that you will get have educational benefits. Take advantage of that. They're giving you free money. Take advantage of that. Do a training, even if it's for a week. Get a new certificate. Because as my buddy would always say, all the experience you get is great, but unless you can document it with a certification or a certificate of completion, means nothing. So always do that and document.
Absolutely. And then five, where can people connect with you?
Sure. So I'm super active on LinkedIn. Just look up my name, Bryan with a Y. So Bryan with a Y, O Buckley. I think I'm the only Bryan O Buckley on LinkedIn. And then you can also find me same way on Twitter as well. So same thing at Bryan O Buckley. And so that's usually kind of the way. And then if you really can't remember any of that, you can just go to bryanobuckley.com, which actually has all of my social medias there and one-stop shop. And if you want to get to know a little bit more about that more detailed story of mine.
Awesome. Well, thank you so much for taking time to come on the show today and really share your story, your experiences, and how you've gotten to where you've gotten to, because I think it's definitely going to be helpful. And I'm glad that we were able to connect today.
Well, thank you for the invite.
Yeah, my pleasure. You were requested, actually, so I had to do it.
Well, even though, thank you so much for the invite, and thank you for just all that you do for public health as well.
My pleasure. Trying to get it out there as best as I can. I'm glad that I got to have Bryan on today. It was a great episode to hear him talk about his story in public health. I really enjoyed just how much he did in so many different roles and how he just really learned from that and built up his public health career and was always like intentionally building his resume. And I think that's one thing that we should all try to do, like try to get one thing, one more rule, one more thing that we can put on our overall master resume. And I think that is great advice for anyone who wants to get involved in public health or just in general. So definitely subscribe, leave a review, leave a like. Appreciate you all. See you all next week. Public Health Millennial out.